Welcome to Adapting Class. Number 9 of the commonly tested topics. These are topics I put it together. I give facts based on what I've heard about people who took the test. And these are things that keep on showing up. So I created this test taking strategy, commonly tested topics. Therefore, let's get to it. It's straightforward. Just go to the content and fish it out. Number 1, the next is caring for a client who needs chest physiotherapy. Which of the following actions by the names indicate correct understanding of the procedure? First, go for the buzzword. If you know the buzzword for the question is chest physiotherapy, always go for the buzzword. And if you figure out the answer choice is easy, what is he asking? Which action indicate correct understanding? Procedure should what? Procedure scheduled 20 minutes after meal. Well, most of the time, chest physiotherapy, they're going to be prone. You want to wait at least 1 hour to 2 hours before you do this procedure after they eat. So the best way is not to eat at all. Do the chest physiotherapy, then you let them eat, right? So 20 minutes is the wrong answer. Client in high power position, they're usually in the prone position and their back is being hit on in order to break down mucus. So high power is wrong. Procedure schedule at least 1 hour before meal, right? Procedure schedule 1 hour before meal. So they do it 1 hour before the patient go and eat. So if the patient is going to eat 8 o'clock, I'm doing the procedure at 7 o'clock. At least that means I can do it 5 o'clock, 6 o'clock. So this is excellent. Procedure schedule at least 1 hour before, right? Meal, though they do the procedure before the patient eats. Client in same position. No, not a lot of position. So 3 indicate correct understanding. I just want to give you ideas that I would see they will usually be asking. That's why I said the question this way to confuse you a little bit, right? Which of the following the nurse should include in the teaching? You see the way I answer the question, I go back to the buzzword from the back. Which one should you include? What is the problem? And nurse is teaching new graduate about care plan for a client with cystic fibrosis. You know cystic fibrosis patient, that is the buzzword. What should you include in your care plan? Go over the lung and the pancreas. Those are the things that usually these people have problem with. Avoid what? Hot weather. What is the problem? They have sodium chloride channel. So they lose a lot of sodium. Therefore, if they go outside and it's hot, it's a problem. This is good. Exercise are related. Even though when they go outside, they're going to lose some sodium, exercise is good for their lung. But we don't want them to go outside when it's hot. So ADEK vitamin replacement. These are fat-soluble vitamins. They cannot absorb fat. So therefore, this should be included. Salt tabs, they need sodium chloride. We give it to them. 2 to 3 liters of water a day because they're losing water due to loss of salt. Replace their salt and water. Therefore, all these things should be included. So 1, 2, 3, 4, 5 should be included in the teaching. Okay. Next question. Number 3, a nurse is caring for 4 clients post Mantoux test. Which of the following the nurse should consider as positive? So which of this is positive? Keyword, Mantoux test. What does that mean? This is skin test for tuberculosis. What you need to know, 5 millimeter for people who are immunocompromised, 10 millimeter for people who are homeless, 15 for normal people. A client with diabetes is a normal person. 5 millimeter is wrong. Hypertension is a normal person. 6 millimeter is wrong. Client with leukemia is immunocompromised. 5 millimeter is correct. A client is homeless. This has to be 10 millimeter before it can be positive. Therefore, the right answer is number 3. Next question. 4. A nurse is caring for 4 clients after chest tube placement. Which of the following clients need immediate intervention? Buzzword, chest tube. How much chest tube do you know? Check out Adapting Class for content review. But there is component of the chest tube that you have to know what happened. Collection chamber, water seal, air seal, and then suction chamber. You have to know what happened to each component in order to be able to answer these questions. A client with continuous bubbling in the suction chamber, this is expected. A client with no bubbling in the collection chamber, this is expected. A client with continuous bubbling in the water seal chamber, this is not expected. A client with intermittent bubbling in the air leak chamber, this is expected. Therefore, which one need intervention? Number 3, we need more help. I have a great chest tube video that will tell you everything that happened in this chamber. That is all you need to know for chest tube. Okay, so 3 is the right answer. A nurse is caring for a client, prescribe Enoxaparin after DVT. Which of the following teaching is appropriate? Buzzword, Enoxaparin, which teaching is appropriate? Take the medication by mouth once daily. No, it's given as sub-Q. Limit fresh leafy vegetables. No, it's not Coumadin. You don't need to change your diet. Stop the medication if platelet drop 50%. Yes, it's an heparin, and it can drop your platelet. And if you drop 50%, that is heparin-induced thrombocytopenia. That's bad. Check PTT and adjust those. You don't need to check any of them because this is only sub-Q Lovenox, which Enoxaparin, which is therapeutic, but you don't need to check any PTT, even though it's heparin. The only thing you check PTT for is heparin drip. So that's not the right answer. Number 3 is the appropriate teaching. Number 7, and this is teaching new graduate about needle size for therapeutic injection. Which of the following needle size is appropriate for tissue level, for the tissue level selected? These are some of the questions people say they keep on showing up about needle, what size to use. Well, you got to learn it. If you don't draw if they give you can figure out, draw a tissue, right, and divide it. The top is epidermis, right, and the top layer of it is dermal area. Then this is subcu. This is where the fat, and this is the muscle. Therefore, the thicker the needle, the better it can go. So 1 inch for intradermal, which is right here. No. 8 inches is subcu. What do you think? 5. That is, so this is the sizes. Intradermal, usually we give you like a 1/4 to 5/8, basically, right? And then subcu 3/8 and 5/8 inches, right? And the IM is 1 inch. So based on that, 5/8 inches subcu is better. 2 inches for intramuscular is too deep. You need just 1 and 1/2 inches. 1 inches for subcutaneous is wrong. So these are the sizes I've given you. Just master them, and you will never get these questions wrong. And this is assessing the client diagnosed with schizophrenia. Which of the following the nurse should document as a negative symptoms? Keyword is what? Schizophrenia. There is a positive and a negative symptoms. Positive symptoms is what diagnoses schizophrenia, and negative symptoms, call them depressive symptoms. What diagnoses schizophrenia? Delusion, disorganized thought, hallucination. These 3 things are positive symptoms. This lacked affect, it looked like depression. Pacing, looked like depression. Disheveled, looked like depression. So 4, 5, 6 are all negative symptoms. And the last one. And this is observing the client practice incentive spirometer. Which of the following action steps require further teaching? Do you know how to teach a patient to do incentive spirometer? Yes. They excel normally, and they place the mouthpiece. So they place the mouthpiece in their mouth, right? So this is correct. Client seal the lip tightly around the mouthpiece. That's correct. Client exhale. No, they need to inhale. This is what the patient makes mistake all the time. They need to inhale deeply to open their lung. Incentive spirometer is designed to open your lung to break atelectasis. So they need to inhale deeply to move the piston. If this is the incentive spirometer, There is a piston here. You inhale deeply, you push the piston up there. So exhalation is wrong. So this is wrong. Client breath for 2 to 3 seconds. That's good. Client inhale. No, you exhale slowly now after you have inhaled. Slowly around the mouthpiece to let everything settle down. So 3 and 5 need intervention. This is the end of it. Take care of yourself. Test taking strategy number 9 down. Take care. Bye bye.